Okay, I wanted to talk to you about ice today and the way that I managed to control my pain. So this is my little ice machine, and you'll see the name here is called Cold Rush. Cold Rush. And then on top of it, it says Cold Rush, Cold Therapy, Quick Start Guide. Gives you instructions on using it, Cold Therapy. I can't say enough good about this device. What it does have is it has the ability to really help me get adequate cooling through the night. So trying to do this one-handed here, show you that there's a chamber inside here. You fill the water up to the fill line and then fill the remainder up to the top with ice. Now mine has melted because I used it overnight. Then you close it. It has then a dual tube system that flows the cold water past the ice and then out into the pad that goes against your skin. And this is the pad I selected. They do have other pads available, but this can mold around somewhat around your joint. However, as you can see, it's fairly lightweight. So although I like the system, I do use it in combination with my body ice. And I've told you about this before, Body Ice by Dynatronics. This is fantastic, and just so you get an idea of how big that pad is relative to my hand, this is a huge chunk of ice, and it is, even though fully frozen, it still is soft like a gel, right? And there's a lot of cold in this, and sometimes I use 2 of them, so I wrap the whole joint, 360 degrees backside and right through around the leg and the hip and on the outside and inside. So that really is very effective. Now, because they get so cold, sometimes I use my little flaxseed warmer. So I take this, put it in the microwave for a little bit, put that right over my heart chest. Now, I do not have anything that decreases my sensation. So I feel pretty confident that I am not overcooling or overheating my tissues. But I do suggest that you always put a towel between this product or any of the cold treatments and your skin. And the same with the heat treatment. Make sure you don't overheat the flaxseed warmers because you don't want to have burns from either one of those. So those are some of my ways of helping control the sensation in the joint and really keeping it comfortable as I'm healing. This has been allowing me from the beginning not to have to use any pain medicine. I did use a little bit of ibuprofen on the first day and some Tylenol on the first day, but not since then, and it just really helps modify through the night even with this big heavy gel ice pack in combination with this. So I put this one right next to the skin, and this one has a soft fabric side. I can put that right next to the skin and then pop this one over the top. But I do wear my pajama pants, so that's the fabric between the skin, between the skin and this device. Now, because I do it that way, then I put the colder side down against my pajama pants. If I am going directly on the skin, then I use the fabric side on this, but then this would be, the ice pack would be towel wrapped. Okay, so sometimes I use the little towel here to wrap the ice pack if I'm going to go right against the skin, and then the towel is the barrier. All right, I hope that all makes sense, but yeah, I've had a lot of luck with these giant quantities of ice, and I keep rotating them in and out. I have about 3 or 4 of the big body ice packs, plus I have this cooling system that I found on the internet. All right, have a good day. Bye.